For us, it started on a Sunday evening when we received notification from my daughter's childcare that they had a positive case.
Jessica Foggy and her husband took extra precautions after they were notified of a COVID case at their daughter's childcare centre.
We were religiously checking temps every day. No temperature, not even a cough or a sniffle. She's been running around her usual self.
Within a week, Jessica and her husband had both caught COVID, becoming so sick they had to go to hospital.
So the first few days, I just felt like I had a cold. By day 4 or 5, that was when I started to really get hit with a lot more symptoms. So a lot of cold, like chills, hot and cold. Couldn't really eat or drink a lot. I was quite nauseous.
At the same time, Jessica's 4-year-old daughter tested positive, even though she displayed no symptoms of the disease.
My daughter, she's been the luckiest of everyone. She's been asymptomatic the whole time. You wouldn't even know she had COVID if I didn't tell you.
Across Victoria, around 1,000 children and teenagers currently have COVID-19. 378 cases are kids aged 9 or younger. One of Melbourne's outbreaks among children occurred at Al Taqwa College, an Islamic school in the city's west.
Some of them are getting a bit anxious, even with a little bit of flu-like symptoms, because we've been hearing about it from social media or TV, or maybe a little bit of parental concern. And even if they don't have COVID, they're still worried about it.
Some infected students are patients of local GP Dr. Farnoosh Nia, who suspects that they caught the virus from their parents.
It wasn't from school, it wasn't from another kid. They usually got it from their parents. Usually if there's let's say a family of 5, there has been at least 2-3 people infected and 2 people were not infected, because the virus really acts differently in different people.
What we are seeing is that children are not the main drivers of infection, particularly when we look closely at households. They often are receiving this exposure from adults in the household and are much less likely to go on to transmit this infection if they are the index case to their close contacts.
Medical experts believe young children with COVID-19 generally show milder symptoms compared to adults. They make up less than 5% of total cases in Australia.
There are some very rare complications which are being described in places where there's very, very high transmission of the infection, such as in New York and London. However, we haven't seen those sorts of complications arising here.
The Board of Health just called me and I tested positive.
Thousands of kilometres away, Jennifer Culligan tested positive for COVID-19 in April, several weeks after her 3-year-old and 7-year-old daughters also fell ill with the virus.
March 19th is when I started with my symptoms. 5 days later, the cascade of fever, diarrhea, pain, because I really feel the kids don't get it as bad. It's when they give it to us, the parents. And how are we supposed to social distance from your children?
In contrast to her own symptoms, Miss Culligan's children recovered quickly from the disease, but she's worried about any potential long-term effects.
It definitely caused major anxiety for myself. I think a little bit for her sister as well. Seeing her sister, they share a room, and you're hearing her coughing throughout the night. My girls had it. Do they have antibodies? I haven't had them tested yet. I have them, but apparently they only last for so long. Do I want to go through all this again? Because what if we can get it again?
In the US, the number of infections is reaching critical levels. Nearly 500,000 children have contracted COVID-19 since April, and 76,000 were infected in just the last 3 weeks.
It's becoming more clear, especially in the United States, as some schools have reopened, that more kids are getting infected. The proportion of people infected being young children and young adults are rising.
Chicago-based paediatric infectious disease specialist Dr. Taylor Heald-Sargent is one of many researchers globally looking at how the coronavirus behaves in children. Last month, she and a team of researchers observed levels of the virus in young children on par with adults.
When we looked at our data, we were surprised to find that the children less than 5 years old had the most viral RNA in their nose and their nasopharynx to the back of their throat. I can't say why they had the most or if it affects transmission, but when they got tested, they had so much virus despite those mild symptoms. People were hypothesizing that children weren't getting sick because they weren't able to get infected and they weren't able to support viral replication. And what we were seeing was not true. Our kids that were getting sick were able to have a lot of virus in their nose.
In Victoria, as long as schools remain closed, it's unlikely there'll be outbreaks among children on a similar scale to America. But for parents like Jessica Foggy, there are questions about her daughter still left unanswered.
As we're learning more about COVID and people are discovering more about how it affects us long term, my main hope is that there's no lasting impacts for her. Like, I understand that she's had no symptoms now, but we don't really know how it works inside the body.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.